Good afternoon. My name is Amal Nergurkar. I'm the CEO of Patient Prism, and look, who we have in the studio is Rachel Wall, one of my closest friends, and co-founder and the founder of Inspired Hygiene.
Yep, founder
And
CEO.
she is doing incredible work in this space. We share a lot of clients together. I am a big proponent of optimizing hygiene departments, whether you're a single practice or DSOs. And Rachel does it better than anybody else in the business, period, right? It's not an exaggeration. It's not an hyperbole. It's just fact, right? It really is. And my question to Rachel is, we've done a lot of recordings together.
Yeah.
The question, since we're at a DSO conference,
Yep.
the question is, what are you doing to really drive this hygiene optimization within DSOs? Because it's slightly different because of the scale that they're at.
It is slightly different too because we're working with multiple locations. A lot of the locations have been acquisitions, so they come with their own culture.
Absolutely.
And the DSOs that we work with, they respect the dentist. The dentist makes all the clinical decisions, and they respect the team, and they want to bring them into the culture of the bigger organization. But that takes time.
Right.
So you have to work within, you have to meet the teams where they are and then create consistency. That's really what we're looking for across the platform is consistency with standards of care, consistency with verbal skills, consistency with how the patients move through the hygiene appointment, what happens in the hygiene appointment, and all of it in an effort to just make sure they're providing best-of-class care and that the team's happy and the doctors are supporting all the treatment and that the department's profitable.
I mean, the consistency is really the name of the game
Yes.
when you scale a business, right? Because you want consistent, repeatable processes.
Yep.
And that's what builds platforms, and platforms get sold for a lot of money, right? You can't have a group practice, cannot be just a collection of practices, right?
Yep.
You have to act like, you cannot be a group of practices. It has to be a group practice, which
Yes.
means they have to act like one.
Yes.
And that's why all the communication and messaging and training, all that stuff has to be consistent.
Yep. So the term that I've heard, I think our friends at Tusk, I heard first from them was dots on a map, right? Are you dots on a map or do you have a platform business? And in order to create that platform business that requires those systems and consistency and having the team all on the same page.
One of the things that I was amazed by is the growth you're driving to these DSOs right away. Like, having Inspired Hygiene within 90 days, you're seeing just incredible growth with their perio operations, with especially on the perio side.
Yep.
And not only that, but you're also affecting the growth on the case acceptance side. And that's almost 90 days is nothing. And so tell us some success stories, obviously without naming names, about
Yep.
what kind of growth have you been able to achieve with these DSOs within a short period of time?
Yep. So one of the things that we see often, like you said, there's a lot to do in the hygiene space and the hygiene department, but still across the board, one of the number one requests we get is help us develop our perio program.
Right.
And help make it simple and streamlined and across the board and help us with verbal skills so that these practices that maybe haven't had the opportunity to have that type of education or coaching, how do they explain to their patients that they've been seeing for 15 years that, now we're recommending some different type of treatment.
Right.
And so we give them specific verbal skills with that. But before we start any of that and before we go in and just say, hey, we're here to provide this system is we've got to listen to the hygienists. We've got to listen to what they really think is going well already in the hygiene department and respecting and honoring that. And then what they feel like could improve and what they're frustrated with. And a lot of times we can then direct our coaching towards, hey, this is going to actually help make your life easier. And so what we often see is, 3, 4, 5 times the amount of periotherapy
Wow.
that's
a
being
lot.
presented and accepted. And the hygienist saying, you know what, I'm really surprised at the number of existing patients that accepted treatment. There were a lot of people that I thought were going to be resistant, and they're not because we teach them a really specific method to do
So the
that.
hardest thing to do in a dental practice that I have learned in my years is to change behavior.
Yes, absolutely.
And the way you change behavior is you have to get the buy-in.
They have to want to change the behavior.
Exactly right.
Yeah.
And that is why you're so damn successful, is because you are making sure that the hygienists buy into it, doctors buy into it.
Yeah.
That's why you go in and spend some time and
Yes.
observation and all that
Right.
stuff. That is the real change. If you want to
Yeah.
affect real change in your practice, you cannot do this online,
Mm-hmm.
right? You can do all the online stuff in the world, but at the end of the day, you've got to get people to meet other people, and you've got to get them to change their behaviors, implement good habits,
Yeah.
get rid of bad habits, and that is why you drive all this tremendous growth, 3 to 5 times in terms of more
With
production,
just in the matter of a few months. Yeah.
within a few months.
Well, and they've got to trust the advisor too, right? So it's all, like you said, building a relationship. And we use a combination of in-person coaching and training with some virtual,
Sure.
support.
Sure.
And that's the other piece too. We don't just come and drop the content and leave.
Right.
We make sure that, they have a mentor, they have a guide, a coach that's there, because things are going to come up. They're going to have obstacles.
Absolutely.
That's normal when we're
Absolutely.
changing behavior.
Right.
Right? It's not an overnight thing, but they've got to have someone that can provide them with some solutions, can listen and say, "Hey, try it this way." And also to celebrate when they have success, cuz so often we're just on to the next thing.
Absolutely, and that's why I think what we should end on is this accountability piece, right?
Okay.
Because at the end of the day, you can go to any conference, get Rachel Wall and to do hygiene herself, but it's not going to work.
Right.
It's not going to work if you don't hold people accountable.
Yeah.
For their stuff, and that piece
Yeah.
is very crucial.
It is crucial, and I would say the other piece to it, the difference between a seminar and coaching is that the coaching can really be customized, and you're really listening to like what you're seeing, because we're there hands-on looking at
Absolutely.
the practice, so you're seeing what they're dealing with, from the relationship of the doctors to the hygienist to the schedule and all of that.
Right.
So you can really address all that, and then you have that ongoing support piece.
Perfect. It's such a pleasure to,
Thank you.
every time I spend time with you, I learn so much about the business of dentistry. And I am excited to see what happens with both our organizations over the next few years.
Me too.
And it is an honor and a pleasure knowing you. Thank you.
Well, thank you, Amal, and thank you for just being a champion for so many of us in the industry, and for all you do for the industry, because it's
Thank you.
making a difference.
Thank you.
My pleasure.